Welcome to the webcast for Queensland Stakeholders, proudly brought to you by the Office of Industrial Relations. The Workers' Compensation Scheme data shows that hand injuries are the most common injuries in a small business. This webcast will provide small businesses with an understanding of how complex simple hand injuries can be, more than you expect, and how you manage the rehabilitation and return to work for your workers. Our presenter today is Dr. Cameron Mackay, one of Brisbane's leading hand surgeons and plastic reconstructive surgeons. Dr. Mackay will provide great insight into the intricacies of hand injuries and their rehabilitation. The Office of Industrial Relations is committed to delivering short and sharp education to small businesses to improve rehabilitation and return to work outcomes to reduce claim durations. Thank you, Dr. Mackay.
Thank you. Welcome everyone. My name is Cameron Mackay. As has been said, I'm a hand surgeon, plastic reconstructive surgeon, and I want to talk very briefly or as quickly as I can today about hand injuries and why they can have such a big impact on workers, even though the fingers themselves and the hand is such a small organ. So a couple of things we're just going to talk about is common problems and why little things can have a big impact, how we manage return to work, and what the key relationships are when we're trying to manage complex injuries. I'll start this with a little case example. This young worker was working on a demolition site, had a laceration to his finger. It's only small over his little finger. He was seen in a local clinic and sutured up, and his fingers were strapped together. 10 days later, he went back to that practice for suture removal, and he reports some pain and an inability to move. He was diagnosed with a pain syndrome and given a certificate off work for a month and then referred to a pain specialist. Pain specialist put him on some medication, and after 3 months, no progress. His finger was stiff, painful and contracted. The employer was upset with the situation and dismissed him. He was referred to an independent examination by WorkCover. The independent examination found there was no notes, no summary, no diagnosis. A delayed reconstruction was unsuccessful, and he had his finger amputated at 9 months post-injury. So the question is, what went wrong? And it sounds far-fetched, but this is a real case. Firstly, we have to understand the hand. The hand is extremely complicated anatomically, and in a very small space, there are a lot of very important structures. Taking the fingertip, for example, we can see within a very small distance from the skin are tendons, bones, nerves, and it's very important in our hand function. This representation is of the organs as they're seen by the brain, and the hands, you can see, have a very disproportionate representation in the brain. They're very important neurologically and functionally. So little things can make a big difference when it comes to hands and fingertips. Our overall goal is to return a worker to maximum function in minimum time. So we're always looking at the speed of recovery, but we have to take into account the injury and getting them back to their best. In hand injury, scarring and swelling and inflammation are the enemy and can cause great contracture, pain and loss of function. So we talk about the basics of hand injury. We need to consider the very essential elements. And this is very non-medical. We have to know what the diagnosis is. We have to know what our plan for rehabilitation is. We have to have this all documented, and we have to communicate between the key people in the rehabilitation, including the worker, about where the case is going. Diagnosis is essential, and that seems, again, a simple thing, but in our first case example, the diagnosis was not made. Treatment can't proceed properly without a diagnosis, and if a diagnosis is missed, it makes the problem even worse. Things like RSI is not actually a diagnosis, and something like sprain is borderline. When someone says RSI, we need to know what that actually means. The quality of the diagnosis and accuracy is paramount to the whole case, and the diagnosis has to be scientific and based in fact. Again, looking at a case example, doesn't need any explanation of what's happened here, but this worker could just have this nail removed and a bandage put on it and walk away, but we've not really made the diagnosis of what's happened. If he then came back a month later saying he had numb fingers, we wouldn't know what happened to the nerve. A surgical exploration can provide the answer here, and we can see the nerve, although the nail is passed right next to it, the nerve is intact, and we know it will recover. We know that any symptoms will be transient. The medical plan, once we got the diagnosis, is to speed up treatment, reduce stiffness, reduce swelling, and get the worker prepared for mobility and strengthening and back to work. But we can't speed biology, so certain injuries take a particular time to heal. These timelines are fixed, but it's not all bad when we're planning a recovery. These timelines allow us to set down some goals, management plans, and return to work strategies. If we see a dislocation like this in a finger, we know that this work will take 6 months to rehabilitate. But that doesn't mean they'll be off work, it just means they'll be on suitable duties for many months having therapy. This one with a fracture we know will take longer. But if it's not done well, they end up with contracted, useless fingers like this. So our plan needs to be holistic. We have our diagnosis, we outline the path of recovery, and we have an early suitable duties program. And this is the key, having everyone addressing the return to work and suitable duties equally and with respect to the rehabilitation. And then while they're returning to work on their suitable duties, they have intensive therapy and rehab to maximise their function. If they deviate from the plan or things don't recover the way we'd like, then we have to intervene early to get them back on track. There are a lot of other things to consider in terms of what type of work they do, whether they'll be able to do that work, or whether they have to go to a host employer while their rehabilitation is taking place. The total incapacity should be no more than necessary. In most cases for a hand, the rest of the patient is uninjured, so the time off work totally is very minimal, less than a week in most cases. After that, suitable duties are more than appropriate. We have to take into account, though, there may be psychological difficulty, economic hardship, relationship breakdowns due to injury, anxiety, cultural issues, and chronic pain. All of these things need to be accounted for and respected during the recovery. This little chart just talks about how the worker's interest is mostly at the injury at the start and not at all with work. But after a period of time, the injury becomes less important and work becomes more important. And if we leave things too long, other issues start to creep in. We talked about, I wanted to mention key relationships, and there are relationships between the doctor and the patient, the doctor and the insurer and the allied health staff, but there's equally important relationships, as stated here, between the insurer and their claimant, the employers and the doctors, and the employer's got a very important relationship with the employee. If they maintain good relationships during recovery, it can make a huge difference to the patient's outcome. The therapy and rehabilitation takes the form of hand therapy. These hand therapists are highly trained and do all sorts of clever things to get the hand moving quickly. This extends all the way from wound management up to work hardening and graded return to work programs. They're essential, and they'll take place in clinics like this where the workers will come once or twice a week to have their rehabilitation monitored. Medically, we manage a number of things during the recovery, but mostly it's important to understand that we're working on therapy and the return to work. Every workplace injury is a medico-legal case, so the documentation is thorough and clear. Unfortunately, this is uncommon and it can make it difficult if the pieces are being picked up later. So what could go wrong if not done properly? And we mentioned this at the start. A neglected hand results in pain and swelling and stiffness. There can be conflict, there can be later legal coaching, and sometimes biology can be our enemy. This is a neglected hand that will never function properly. Small lacerations like this can lacerate tendons and result in loss of function. Other examples are carpal tunnel syndrome, simple tenosynovitis, and trigger fingers, which can be misdiagnosed and cause large problems if missed. This leads us to our second and last case of a worker who was injured when lifting objects repetitively off an assembly line. Note, it's not an RSI. They have tendinitis of their wrist. They present only after 4 months of physio and all sorts of treatment, with lots of negativity and full of ideas that have been fed to them by treatment over that time. They're off work, they're frustrated, they're in conflict with the employer. And what went wrong here? It's the same things again. They needed a diagnosis, they needed an early plan and return to work, documentation and monitoring, as well as identification that things weren't progressing well and early intervention. These simple things can make a big difference in a structure and organ like the hand, where small injuries really mean a lot, especially to workers. Thanks for listening today. Hopefully that's a quick summary of how hand surgery and hand injury can be important in the workplace and how we can better manage recovery.
Thank you, Dr. Mackay, and thank you for listening to this webcast for small to medium businesses. This presentation was presented to you by the Office of Industrial Relations. To access more information on Queensland's Workers' Compensation Scheme, please visit our website, worksafe.qld.gov.au.